Welcome to the Orthodontics and Interview podcast, where Farooq brings you closer to the experts in orthodontics so we can hear their story and learn from their experiences. With your host, Farooq Ahmed.
Welcome to the second episode of Orthodontics in Interview. And I'm really excited to have our second guest, Dr. Flavia Artese, all the way from Brazil. Now, Flavia is the Associate Professor of the State University of Rio de Janeiro, and she completed her training at the Federal University of Rio de Janeiro. She's also the Editor-in-Chief of Dental Press, Journal of Orthodontics, and she is an established academic within the field of orthodontics. So, Dr. Flavia, a very warm welcome from London.
Thank you, Farooq. It's a pleasure to be here in your podcast. This is my very first experience in a podcast, something brand new for me. And it's a pleasure to be speaking to people all over the world. Thank you very much for having me. Greetings from Rio.
And thank you, Flavia, for joining me today. It's an absolute honor to be able to interview somebody of such eminent status within the field of orthodontics. So, Flavia, starting off the interview, you've published extensively and also recently had a webinar on anterior open bites. I'm really interested to know, where did your interest in anterior open bites begin?
Well, that's an interesting story. To make a long story short, is I have an open bite myself, and I was treated 3 times orthodontically. They were all successful treatments, but my open bite relapsed. And because of that, obviously, I have a personal interest on the subject. And I think that because of that, my first orthodontist, who was my father, had his personal interest as well. And he was able to have a closer look at me as a developing child and also as a grown-up on what he thought were the causes of my relapse.
So it's the personal experience of having had the malocclusion, and who would know it better than the person who had had it? Flavia, I do need to ask, do you still have that anterior open bite?
Well, I was treated a 4th time, and it finally closed. Wow. But I am a class 2 also, and I still have an overjet. So you see, I'm not completely happy with my outcome, but after you're 40, you can deal with it. It's fine.
Fine. Well, if you want to have a 5th go, Flavia, you're more than welcome to come to my clinic in London.
Oh, no, Farooq. I think I'll go to London to meet you for other reasons, not to wear braces again.
Flavia, that may also be questioning my clinical skills there. But on a separate note, Flavia Artese, what is your favorite food?
My favorite food is shrimp, which I just find delicious, but it's not a very social favorite food because a lot of people are allergic to it. So sometimes I'm in trouble when I ask for the dish in a social situation, but I really enjoy shrimp.
Fine. That's really good to know. So, Flavia, you're an educator. Your lectures and presentations, but also locally, you're involved in teaching and training. So, your registrars or your residents that you have, what is your pet peeve? What is the thing that gets under your skin when you're training them?
Well, first of all, pet peeve, that was the first time I ran into that word, and I really did enjoy it. It's increasing my English vocabulary. And what I really hate when my students ask me on the clinical floor is something to do with clinical behavior. I usually, when they start going to clinic, I explain to them that we have to have some protocols regarding how we approach the patient and how we deal with the fact that you, even though you're in a clinical environment, you are also in an academic environment. And what I really hate when they ask me if they did something right in front of the patient that's sitting right there. I have the feeling that the patient looks at me asking for help as if they are guinea pigs. And it's really a very uncomfortable situation. Residents have to understand that there has to be a very respectful concern with these patients that will be tremendously special for them throughout their lives. These patients are the ones that allowed them to learn their skills when they were being trained. So that's what I really hate the most, definitely.
Yeah. And patients are vulnerable creatures. So in that scenario, they don't want to know that the person operating on them or treating them is unconfident. So that's really interesting. Flavia, you grew up in a household of dentistry. So it's really interesting to know what is that you wanted to be when you were growing up.
Well, my father is an orthodontist and my mother is a pedodontist. So I had this major dental influence at home. But, as every child, they really have this aspect of rejecting their role models for a while. So I went through many phases. The first one I remember, or the story they tell me when I was small, when I was about 4 or 5, was my mother asking me what I wanted to be when I became an adult. And the answer was, Mom, I want to be a grown up. And that's, one of those child questions that are very direct. But later on, because I studied in an international school, I studied in a British school. There were so many diplomats. I wanted to be a diplomat. And then I changed into law school and then all the way to architecture. And finally, when I had to choose, I had no clue whatsoever. So I went through psychological coaching, and through my skills, they said I would be good in healthcare. And I finally gave up to dentistry. It won. It finally won, Farooq.
Perhaps your genetic predisposition was expressed in its phenotype. There was no escape, was there?
No escape whatsoever.
So from that background that you've had and the places that you've been to train, I would like to know, Flavia, who is the person you admire the most in orthodontics?
Well, I think the obvious answer would be my father, and it definitely was. I think that when you choose your parents' profession is because they brought the profession home in a very adequate manner. They always loved, they had passion for what they did. And I think we end up grasping this as children growing in a home. But afterwards, when I started going through meetings and understanding a little bit more about the profession, without wanting to be unfair to anyone, because I have so many role models, I think that the female representatives of my time were people that I really looked up to, such as Beata Melson, Anne-Marie Cooper-Yatzman, Catherine Vig. These were ladies that were there on the stand teaching other people, having a respectful academic life. And me as a young girl was just looking at that and saying, well, I can achieve places that, generally women don't. So I had my female role models, I believe, Farooq.
That's great. And now, Flavia, you are somebody who graces that stage, and I'm sure you are inspiring a generation of female orthodontists as well.
To hear this really makes me happy. That's the biggest thing in teaching. I enjoy teaching very much. Teaching has to do with generosity. When you teach, it doesn't belong to you any longer. You're giving it away and hopefully expecting to people use that information in a good manner. It's a good way of retributing what you did or what you received from society. So it really pleases me to hear this, Farooq. Thank you very much.
My interpretation of your statement is that you've just validated my podcasting. So thank you so much for that. So the next bit of the interview, Flavia, is the audience question. So in social media, we ask a question as to what the general population want to know about your practice and you as a person. So one of the questions we've got is about how do you choose what to publish in Dental Press Journal of Orthodontics?
Farooq, that's a hard question to answer because it has to do with editorship or the way you deal with the administration of a journal. And I would summarize it into 3 things. The first of all, obviously, is the quality of the research in the paper. If it's scientifically clear and it makes sense, and it's just not a repetition of something that has been done. The second issue is citability. I don't even know if that word exists in English, but how much that paper will be able to be cited in future papers. And this has to do with indexations of our journals, the way journals are ranked. And I think that the third aspect is obviously the scope of the journal. What is the scope of readers that you have? Generally, when we receive, for example, local papers with a specific population, that generally would not interest a whole global community. So I think those are the three major points.
And moving on now to the final sections of the interview, Flavia, what piece of advice would you want to give to orthodontists and registrars and trainees who are out there?
Oh, so many things come to my mind, but I think that being in academic life, being in practice, and being in an editor in a journal, I think that the biggest advice I would give a young professional is learn how to have a critical view of what you receive as information. Orthodontics has an enormous input of the industry, and there's so much information that's not really properly sent out, or I would say scientifically based, to be immediately used in patients. So have a critical eye. Don't use everything that you see that is being sold to you as, the miracle bracket or the miracle arch wire or the miracle technique. Orthodontics has to do with adequate diagnosis, good treatment planning, and good orthodontic training. So I think that's the biggest advice.
Excellent, Flavia. Thank you so much for that. And that's something I'll be taking on board as well. Are there any events or things that you think orthodontists should be looking forward to in our profession?
Well, so many events. But one very special to me is the 10th IOC, which is the meeting for the World Federation of Orthodontics, which will be held in Rio in 2025. The 2010 edition was held in London, and we're bringing the 2020 would be held in Japan. Unfortunately, because of the COVID, it's going to be a virtual meeting. And in 2025, we really are looking forward to be hosting the orthodontic community. The motto of our meeting is Rio Embracing the World. And I think Rio will really be prepared to receive orthodontists from all over. And I hope to count on you, Farooq. I hope to see you in these tropical lands in 2025.
I'll be sampling the shrimp from Brazil. That's what I'll be doing.
Well, I promise I'll give you some good shrimp.
So, Flavia, that brings the interview to an end. I'd like to thank you so much for being part of this second episode. I'd like to thank the listeners who have supported this podcast with their enthusiasm and likes. And please do subscribe and look forward to the next episode of Orthodontics in Interview.